Good evening to all. I'm Kishore Kumar CK, Director of Physical Education, Bangalore University. I am privileged to welcome you all on behalf of Department of Physical Education, Bangalore University, to the international webinar on physical training and rehabilitation. Most people know that aerobic exercise is good for the heart, and that resistance training helps to build lean body mass. And most people don't fully understand how these different types of exercise elicit very different responses with other bodies. A basic understanding of how our body uses energy during forms of, different forms of exercise is critical for, designing an effective exercise program. This webinar will focus on energy systems, that is, how the body utilizes fat, carbohydrates, and proteins to produce energy, and how these energy systems are relied upon during different forms of exercise. Today's speaker, Professor Anand Shetty, a well-versed man in this field, will explain us how the energy systems plays a role during physical training. And another session we'll be having on ACL injury. Professor Chris Kinslow from USA will explain about this ACL injury. And he will also explain about rehabilitation and training in sports. One of the most common knee injury is the ACL injury, or we say sprain in the ligament or tear. And ACL injury is a tear or a sprain, is one of the major ligament injury of knee. ACL injuries actually most commonly occur during sports that involve sudden stops or changes in directions or jumping, and sometimes while landing, such as soccer, basketball, volleyball, football, and in these events we can see sudden stops or changes in directions or jumping. So that sometimes leads to this ACL injury. Dr. Chris Kinslow will explain about the ACL injury, its rehabilitation, and after rehabilitation, again they will take up this training program or training programs in sports. About that he will explain. And before starting our session, I will take a moment to showcase our department, about our department through this video. Please bear with us.
ದಿನಪಾಠ ಪಠಣ ಗುರು ಬುದ್ಧಿ ವಚನ ಇದು ವಿದ್ಯಾದಾನ ತಾಣ ಪಡೆದಾಗಲೇನೆ ಸಿರಿ ಶಿಕ್ಷಣ ನಮ್ಮ ಅಂಧಕಾರ ದಮನ ಮಂಗಳೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯ ಮಂಗಳೂರು दिनपाठ पठन गुरुबुद्धि वचन इदु विद्यादानताण परिदागलेनि सिरि शिक्षण ನಮ್ಮ ಅಂಧಕಾರ ದಮನ ಮಂಗಳೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯ ಮಂಗಳೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯ ನಮನ ನಮನ
ಜ್ಞಾನವೇ ಬೆಳಕು ಬೆಳಗೋಕೆ ಈ ಬದುಕು ಜ್ಞಾನವೇ ಬೆಳಕು ಬೆಳಗೋಕೆ ಈ ಬದುಕು.
Thank you. May I request Mr. Ramesh Chen, Assistant Director of Physical Education, Joint Organizing Secretary of this webinar, former hockey player and a qualified hockey coach, to welcome all the guests and the esteemed participants. Over to Ramesh Chen.
Good evening, all of you. Department of Physical Education, Mangalore University welcomes you to the international webinar on physical training and rehabilitation. Today, we have with us Honorable Vice Chancellor of Mangalore University, Professor P. Subramania Edapaditaya. It's my privilege to welcome the respectful Vice Chancellor of our university, an internationally renowned scholar in the field of commerce and management, who has great interest towards the development of sports in our university. He is instrumental in providing good facilities and scholarship to our university sports persons. He is also the brain and strength behind in implementing new sports programs in our university. On behalf of the Department of Physical Education, I extend a hearty welcome to you, sir. Today, we have eminent scientist Dr. Anand Shetty, Professor and Co-Director of Research, Department of Physical Therapy, University of St. Mary, Kansas, USA. He teaches a variety of classes: anatomy, exercise physiology, biomechanics, research, and comprehensive exam. He has got more than 30 years of teaching, research, and community service experience in the field of exercise science and physical therapy at several institutions. On behalf of the Department of Physical Education, Mangalore University, I extend a hearty welcome to you, sir.
Hello.
Today, we have eminent scholar Dr. Chris Kinslow, Associate Professor, Department of Physical Therapy, University of St. Mary, Kansas, USA. He is an anthropedic certified specialist and holds both level 1 and 2 functional dry needling certification. On behalf of the Department of Physical Education, Mangalore University, I extend a warm welcome to you, sir. I welcome our Registrar, Sri Raju Mugavi, Professor B. Narayan, Finance Officer of Mangalore University. I also welcome Dr. Kishore Kumar CK, Director of Physical Education, my colleagues in the department, and esteemed participants of this webinar. Welcome you all once again. Thank you. Over to Kishore, sir.
Thank you, Mr. Ramesh. Now I request Dr. Haridas Kulur, Assistant Director of Physical Education, Joint Organizing Secretary of this webinar, All India Inter-University Gold Medalist in powerlifting. He will introduce today's speaker, Professor Anand Shetty. Over to Dr. Haridas Kulur.
Sir. Good evening to all. It is my pleasure to introduce today's resource person, Dr. Anand Shetty. Dr. Anand Shetty has completed BSc at University of Mysore with a focus on physics, mathematics, and statistics. After BSc, he attracted towards physical education and completed Bachelor of Physical Education from Karnataka University. He earned a Master of Physical Education specializing in biomechanics and exercise physiology from University of Mysore. He taught in the Hampton University Doctor of Physical Therapy program from 1998 to 2012. He teaches a variety of classes: anatomy, exercise physiology, biomechanics, and comprehensive exam. Dr. Shetty then earned his doctorate from the University of Northern Colorado with a concentration in biomechanics. In 2012, he joined the University of St. Mary faculty. Presently, he is the professor and co-director of research, Department of Physical Therapy in University of St. Mary's at USA. Dr. Shetty has more than 30 years of teaching, research, and community service experience in the field of exercise science and physical therapy at several institutions, starting at the Rice University in 1987. Committed to continuing education, Dr. Shetty has attended several courses in anatomy at Eastern Virginia Medical School and Virginia Commonwealth Medical School, and he regularly attends conferences in biomechanics, exercise physiology, and anatomy. Thank you very much, sir.
Thank you, Dr. Haridas Kolur. May I now request Professor Anand Shetty, an eminent scientist of international repute, to deliver the lecture on energy systems consideration for physical training. Over to you, sir.
Good evening, everyone. I am Anand Shetty, a professor and a co-director of research in the Department of Physical Therapy, University of St. Mary, Leavenworth, Kansas, USA. My educational and professional background. I finished my BSc from MGM College in Udupi with the Mysore University, and I finished my Bachelor of Physical Education from the MAS College of Physical Education, Karnataka University, and finished my Master of Physical Education from Mysore University. And I worked for 2 years with the MAS College of Physical Education, Dharwad. Finished my Doctor of Physical Education from the University of Northern Colorado, specializing in biomechanics of sports. And also I finished my postdoctoral work from the University of Illinois. In this slide, you are going to see 3 different types of athletes. On your left is the sprinter, in the middle it's 1,500 meter runner, and on your right he's a marathon runner. If you see their bodies, they have different morphology due to training and type of energy system as well as nutrition they are using for their activities of sprinting and marathon running. For example, in the sprinter, that sprinter needs power, strength, speed, muscular endurance, and agility. And for a long distance runner, and also especially for a marathoner, he needs high cardiorespiratory endurance, and also he has a high mitochondrial density and very low body mass index comparing with the sprinters. So why do they look different? They look different because of the types of physical training they are involved in, as well as the energy system they are using for their training, as well as the influence of nutrition. As an example, a rule of thumb is that about 100 kilocalories per mile are burned for a 180-pound person whether he walks or he runs. Walking takes about 15 to 20 minutes. Running takes about 5 to 8 minutes. After you run a mile, you feel very tired. After you walk a mile, you're not tired. The difference is that intensity determines the substrate usage. Intensity is measured by the heart rate. One term you need to understand is overload principle. Overload principle is used to increase the intensity, duration, type, or time of workout progressively in order to see adaptations. The adaptations are improvement in endurance, strength, or muscle size. Therefore, the topic for today's discussion involves energy systems consideration for physical training. The objectives are understand how anaerobic and aerobic metabolism interact during exercise, explain the aerobic and anaerobic adaptation to exercise, explain and apply resistance training guidelines for health and sports, discuss importance of nutrition in physical training for sports. The part of the nutrition I will discuss all along as I speak. The specificity of training involves training a person for a specific sport. It may be long jump, high jump, sprints, long distance running. In actuality, what we are trying to train is metabolic adaptations as well as the neuromechanical adaptations. Metabolic adaptations involves physical training and nutrition, and neuromechanical adaptations involves improvement in skills. Both of these, metabolic adaptations as well as neuromechanical adaptations, involves overload principle. In this slide, I am showing you the neuromechanical adaptations, how we have to train for a skill of a particular sport and improve the performance. Neuromechanical adaptation involves skill and skill development. For example, the clips I am going to show you, it shows you some of the skill improvement with resistance training. This is basically a neuromechanical training that involves the skill. You probably understood some of the skills which I have demonstrated in this video that improves neuromechanical adaptations. I will have a lot more to say about this video later in my presentation. As I mentioned to you earlier, there are two types of adaptations taking place due to training. One is the metabolic adaptations, other one is the neuromechanical adaptations. Now I will speak about the metabolic adaptation, that's the energy yielding sources. The main energy source for muscular contraction is adenosine triphosphate, that is ATP. There are two ways we can get ATP for our muscular contraction. One is the anaerobic metabolism, the other one is the aerobic metabolism. Anaerobic metabolism involves without oxygen, and aerobic metabolism involves with oxygen. Under anaerobic metabolism, we have two systems. One is ATP-PC and the other one is anaerobic glycolysis. In the aerobic metabolism, we have aerobic glycolysis, fat metabolism, and protein metabolism. If you look into the terms, like glycolysis means use of carbohydrate. When you talk about fat metabolism, use of fat, and protein metabolism uses protein. In this slide, I am showing you the metabolic substrates and energy production. We have shown you on your left hand side, the flow chart shows you lipids, carbohydrates, and proteins. Okay. As I mentioned to you, all of these energy substrates are used during physical activities depending upon the intensity. The shorter duration type activities involves carbohydrates, and the very long physical activities involve lipids and proteins. Although we cannot pinpoint which energy system is used when, but it depends upon the person's physical training, their cardiorespiratory endurance, and nutritional availability. All of this has to be considered. But do not confuse with the whole picture here. I'm just showing you what energy systems or substrates are used for a particular activity. As I mentioned earlier, there are two systems we use during our physical activities depending upon the intensity. One is the anaerobic metabolism, other one is the aerobic metabolism. Under anaerobic metabolism, we have two systems, ATP-PC as well as the anaerobic glycolysis. When you train ATP-PC system, there will be enzymatic adaptations taking place that would increase in activity of major enzymes, that specifically creatine kinase. There will be faster regeneration of ATP, increased performance of short duration high power activities, for example, sprinting, lifting a heavy weight, serving, forehand, backhand in tennis, can only provide energy for short duration. Only small amount of ATP is available, must be replenished very quickly. Endurance type training has no effect, especially it may have some detrimental effect. Sometimes people use creatine. I do not know the effectiveness of use of creatine. The next fastest energy system is anaerobic glycolysis. That means oxygen is not required, generates energy and lactate. Lactate decreases production of useful energy and diminishing intensity or speed of activity. Energy is made available quickly to muscles. Major energy source during high intensity short duration activities. It's very similar to ATP-PC system, but it's not as powerful as ATP-PC. At the same time, you will accumulate lactate that will hinder your performance unless you reduce the intensity of activity. The examples are sprinting, weightlifting, running and jumping and all of those activities that this uses only carbohydrate. This anaerobic glycolysis is involved with the high intensity exercise associated with greater cardiovascular risk, greater chance of orthopedic injury, lower adherence to training. For example, a sprinter, he has both well-developed both of the ATP-PC as well as the anaerobic glycolysis. When you are in a high level of intensity, they are likely to get some problem with the joints and muscle injuries, and also sometimes they may not recover from the energy they spent. So there's a possibility that there is a lower adherence to training. You may not see that with the athletes that much, but you probably may end up seeing with the general population where they involved in high intensity activities. Now I am looking into the aerobic metabolism that requires oxygen, generates energy, CO2 and water. All waste products can readily be used or expelled. Used at rest and during long duration, lower intensity activities. This energy system is used, for example, this fellow who is doing the marathon, road cycling and distance running marathon, that involves a continuous activities where they don't feel tired. The energy spent is immediately replenished through their anaerobic metabolism. Therefore, they do not reach their fatigue that quickly. So also the energy comes from the carbohydrate and fats. May involve protein also, because if they run 10-15 miles, then a small amount of energy will come from protein. Also, these people may consume 7,000 to 8,000 kilocalories per day. But if you look into their body morphology, they have a very low body mass index because they spend a lot of energy coming from protein. This is a slide that shows you interaction of energy systems. One thing I got to remind you that we cannot shut down a system. Only the contribution of each system may be varying depending upon the intensity. But if you look into that here, it starts with the from your left hand side, it says anaerobic 100%, 90%, 80%, 70%, 60%, something like that, and it goes to 0%. The aerobic system starts from 0, 10. So for example, person who is sprints, it says anaerobic 100% and aerobic 0%. Then it goes from 200, the anaerobic 90%, aerobic 10%. If you look into the 1,500 meter runner and 3,000, there are 50-50, anaerobic 50, aerobic 50. And if you look into the marathon runner, almost 100% aerobic. What it says to us is that depending upon the intensity, the time duration, if you look into time duration, okay, depending upon the intensity, your body knows how to use that energy system, depending upon the intensity as well as the nutrition. Okay, if you look into the 1,500 meter runner, 3,500 meter runner, you're looking into those people have to develop both of those systems, aerobic as well as anaerobic. Therefore, it's very difficult to train people who does the 800 meter, 1,500 meters, or 3,000 meters running. Again, this is a continuation of our discussion in the earlier slide, the interaction of substrates. As the exercise intensity increases, carbohydrate usage increases. Maximal exercise intensity, when you do the maximal activities with high intensity, is 100% energy comes from the carbohydrates. Also, more fast twitch muscle fibers are recruited. Effects of endurance training on metabolism. Endurance training increases delivery of oxygen to the muscle caused by increase in capillary density, increase in concentration of myoglobin, which increases the rate of oxygen transport from capillaries to mitochondria. Also, there will be an enhanced ability for aerobic metabolism caused by increase in size and number of mitochondria in muscle, as well as increase in ability to produce ATP without fatigue. Aerobic training guidelines. When we do an activity for a longer duration and it is continuous, it will develop your aerobic conditioning. The type of activities you may want to involve are jogging, running, cycling, ellipticals, swimming, aerobic exercises. This will help to improve your aerobic conditioning. At the same time, I would like to bring you to your attention that high altitude training, what I meant was higher elevation level training, for example, training in Coorg or in Agumbe, that's a higher elevation, that actually improves your aerobic conditioning due to the fact that there will be increase in hemoglobin levels, that increases capillary density, that increases mitochondrial density, and increased use of fat. And when you increase the fat usage for your workout, then it will be very low level of fatigue happens. Duration for each exercise session for fitness, I am talking about for the general public. It is different for athletes, but here I am talking about the general fitness for people like me and you. Minimal duration threshold probably about 20 to 30 minutes per session. It may involve short duration, high intensity activities so that you can improve both your anaerobic and aerobic metabolism. Long duration, low intensity exercise I mentioned to you earlier. Longer session of moderate intensity recommended for most. That means you're trying to improve your aerobic fitness comparing with the anaerobic fitness. Frequency of training. To improve your performance or to maintain your health, you should have at least 3 days per week that is about 30-minute session. Increased frequency up to 5 days per week increases your aerobic capabilities, and training frequency greater than 5 days per week increases incidence of injury. So that you want to keep up your activities levels 5 days a week so that you can give some kind of rest for your body at least once a week. Intensity of exercise determines what substrates may be used for your physical activities. The most important variable is the heart rate, and also you need to determine your max heart rate. Max heart rate can be determined by the two formulas. One is 220 minus H or Curvenan method. We will use the simple method of 220 minus H. For example, to achieve a minimum threshold of physical activity, we should go with about 60% of your max heart rate. If you are a 20-year-old, 220 minus age, that's 200. 60% of a 200 is 120. So to get a minimum threshold, you need to work at 120 heart rate. Of course, you can go up to 95% or close to 100% of your max heart rate. As you get closer to your max heart rate, that means you are using your anaerobic glycolysis and ATPPC system. Lower end of your max heart rate, you are going at the aerobic fitness level. Progression of aerobic fitness training. If you want to improve your performance, either aerobic or anaerobic, you need to overload your system. Overloading means increasing the intensity, or it may be the duration, or it may be the type of activities you do. It is necessary if continued fitness gains are desired. If you want to improve, then you want to progress and overload your system. For example, the type of exercise may progress from low impact, means walking, cycling, ellipticals, to high impact. That means jogging, running. So what you are trying to do is that you are overloading the system. That improves your performance. Of course, if you want to improve your performance in aerobic system, is different than the anaerobic system. Maybe you want to increase the duration. Minimum threshold we mentioned to you about 30 minutes per day, or you can go up to 60 minutes per day. That increases your duration. That is when you are overloading system. At the same time, you can increase your intensity, going from 60% to 70%, 70% to 80%. As you improve, you need to keep on overloading your system for further improvement. Structure of a training session. It's very important for us to prepare our body to some kind of physical activities. Irrespective of whether it's anaerobic or aerobic activities, you must have some kind of warm-up as well as cool down involved in your workout session. For example, warm-up involves physical activities performed before training to increase performance via physiological factors, increase body temperature, blood supply, and oxygen intake. That will help to increase your breathing rate, oxygen intake, stroke volume, cardiac output, and your heart rate. There are two types of warm-ups. One is general warm-up, other one is the specific warm-up. And general warm-up involves most of the stretching. It may be ballistic stretching or dynamic stretching, or it may be some kind of static stretching. At the same time, that may involve in some kind of running and jogging, so that you prepare your body in general for some kind of physical activities. Then you have specific warm-up that involves activities related to task or sport. For example, for tennis, it involves serving, forehand, backhand, volleys, and some match play, point plays and match plays. Sometimes I have seen top-class tennis players, they do the warm-up probably an hour, hour and a half, 2 hours. Means they are getting ready physically as well as mentally for that competition. Also, we should do some kind of cool down activities so that you can bring your body back to homeostasis, so that you can kind of eliminate the waste products from your body. Cool down helps with that process. And also, your program should involve stretching, flexibility training performed at the end of warm-up, or any form in a cool down is very essential. Stretching before as well as after the activities should be included in your training session. I think yogasana may be very good. You must do some kind of stretching after especially high intensity workouts, before and after. As I mentioned to you earlier in my objectives, I'm going to talk about a little bit more about the weight training. If you want to understand about the weight training, we need to understand the basic structure of skeletal muscles. First of all, I want you to understand there are types of contractions taking place. One is if you look into the pictures of the muscle, the resting state and the isometric contraction, concentric contraction, and eccentric contraction. In a isometric contraction, muscle length remains the same. In the concentric contraction, the muscle length shortens, and in the eccentric contraction, muscle lengthens. So we need to keep in mind what type of training you are going to do, whether it's concentric or eccentric. So what really happens due to training, changes taking place within sarcomere. If you look into the bottom left of your slide, you're going to see a sarcomere, changes taking place within the sarcomere and the surrounding tissues. To accomplish our goals in a weight training program, we must have proper exercise sequence, number of exercises, muscle groups involved, and resistance needed. Therefore, we need to measure 1 repetition max. Also, we need to do repetition max for all exercises. If it involves 10 different exercises, you need to do repetition max for all of them. At the same time, you may want to repeat that, measure that repetition max for every 2 to 3 weeks, because you do make improvements, so you need to change the repetition max. In this picture, I am showing you that I am doing the repetition max for my elbow extension, and the muscles involved is the triceps. As I push the weight down, the triceps concentrically contract, and as the weight comes back, it's an eccentrically contract. It's very important you keep log of your workouts. That means how much weight lifted, how many repetitions you have done, how many sets you have done. The other thing you need to know that there's a ratio between the speed of concentric and eccentric contraction duration for improvement of strength. That is 2:1:4. That means when you push down, it is 2 seconds, and you hold 1 second. As you come up, it's 4 seconds. And also you need to maintain a very good posture, and you need to stabilize your abdominals. And during a concentric contraction, you need to breathe out, that's expiration. And also during eccentric contraction, you need to breathe in. I'm showing you, I'm doing the 1 repetition max for my elbow extension. Make sure that your elbow angle is about 90 degrees each and every training session, not only just repetition max. It should be done for every session of physical activity and for each and every physical weight training you are going to do. And also your distance from your body to the weight is also very important. So maintain the posture all the time, and you need to keep a record of those events which you are going to do. Resistance training guidelines. you need to know what type of exercise you're going to do. It may be free weights or barbells or dumbbells or any kind of weight machines. Also, you need to know the volume of an exercise session. That includes how many exercises you are going to do. It may be 10 or 12 different exercise machines, and also how many sets you are going to do for each exercise, and also you need to know how many repetitions. It's very important to know that repetitions and the sets and number of exercise determines how much what energy system come into play. So if the repetitions are very high and the weight is very low, that's what is going to happen. If you want to repeat an exercise for 20 or 30 times, you need to lower your weight. Then you are going to improve your muscular endurance. Also, you need to think about rest period length between sets and exercise. Effects of resistance training. What really happens due to weight training to us for the muscles as well as for your body? Specifically for muscles, there is a hypertrophy. Hypertrophy is nothing but the increase in size of muscle fibers, which we looked into the motor unit as well as the contractile unit of a muscle, the sarcomere. There will be increase in the proteins within the sarcomere that increases the hypertrophy. That means increases the size of the muscle. As you do the exercise, weight training exercise, results from protein and new myofibrils to existing fibers, making them larger. Requires addition of myonuclei to support increase in muscle fiber size. So what really happens is basically there's an increase in muscle fiber size. Also, there is a controversial, they say there's an increase in number of muscle fibers, which I do not know, but I can assure you that there's a hypertrophy because happens due to weight training. Compatibility of exercise training programs. Conclusions from different research studies of concurrent endurance and resistance training. Strength can be compromised due to endurance training. That means if you train for endurance type activities, for example, long distance running, marathon running, that will compromise your strength. Power may be compromised more than strength. If you do long distance running, power may be compromised more than your strength. Anaerobic performance may be decreased due to endurance training. What really happens is that if you work out long duration activities, of course it's going to affect anaerobic performance because we are training only aerobic system, not anaerobic system. Endurance capabilities are not diminished by strength training. What it says is that if you do strength training, endurance capability may not be diminished as much. In this slide, I am showing you how to train for strength, power, and muscular endurance. As you probably know, 1 repetition maximum by this time. I'm going to say my elbow extension repetition max is about 100 pounds, although it was only 80 pounds, but I'm going to consider it 100 pounds. So volume of exercise is considered when you include repetitions, sets, and weight lifted. Volume, unlike intensity, is the key determinant factor of the magnitude of the training effect. Volume is cumulative. So what you're trying to do is that volume includes how much weight you lifted, how many sets you have done, how many repetitions you have done. Depending upon the repetitions, number of sets, weight lifted, that determines your strength, power, hypertrophy, and muscular endurance. So as I mentioned to you, you can do 2 to 3 days of weight training exercise for general fitness and rehabilitation, or 4 to 6 days for advanced for athletics. To improve your strength, it says it's about 70% of repetition max. That means if I had elbow extension of 100 pounds, 70% is 70 pounds. Then you do 4 to 6 sets and 8 to 12 repetitions, and rest is 1 to 2 minutes. That improves your strength. For power, when you talk about power, immediately you need to recall power is related to speed, how fast you are going to do. So to improve your power, specifically for your sprints and vertical jump, like a volleyball serve, tennis serve, and all of those activities, power is involved. So you need to increase your weight. It's 90%. That means 90% of 100 pounds for elbow extension is 90 pounds. So it's the high sets and low repetition. Low repetition, maybe it says it could be 4 to 5 sets, 3 repetitions, okay, or 5 to 6 sets, 1 to 2 repetitions, or up to 7 to 8 sets of 1 single repetition. More rest between sets. You need to have a lot of rest in between sets for power development because your speed is involved. To increase your hypertrophy of your muscle size, that is you got to go about 70 to 85%. Repetition max 4 to 6 repetition, 4 to 6 sets and 8 to 12 repetitions. And to improve your muscular endurance, this is recommended. Muscular endurance is recommended for individuals who are doing a general fitness or elderly population. 40% of repetition max, 20 to 30 repetitions, and maybe 1 to 2 sets. So 1 to 2 minutes rest in between. Resistant training guidelines, again, the frequency of training is there, as I mentioned to you, how many times per week muscle group is exercised. It may be 2 to 3 times for the general population, and maybe 4 to 6 times for the athletes. And also whether you are going to do total body resistance, all muscles are trained in each session, or you can have a split routine depending upon the upper body or lower body, right side, left side if you want to, or the extensors or flexors some other days. You can do the alternate days of exercises for different groups of muscles. And also the intensity of exercise is measured % of max weight possible for one complete repetition. Intensity is determined by the repetition max and the weight lifted from that repetition max. Progression of resistance training, as I mentioned, is an overload principle, gradual increase in intensity and volume, shortening, lengthening of rest periods. If you shorten the rest period, you're going to increase the anaerobic activity, and if you're lengthening the rest period, you're basically improving the aerobic fitness training through weight training. And also you need to recalculate repetition max for every 2 to 3 weeks and keep record of those activities. This shows you the classic strength training regimen, which already we mentioned. This is a modifiable, and it shows you how to improve hypertrophy, strength, power, and peaking. It shows you the sets, repetitions and per set, volume, and also the intensity. This is the one we already showed you. So this can be modified as it is needed, but at the same time you can create your own depending upon your status of your fitness. If you stop training for strength, you will lose strength and power in time. Maybe in about 3 or 4 weeks you probably lose quite a bit of energy as well as strength and power. At the same time, reduced volume will also affect your strength and also your power. Comprehensive training program. You need to work on the strength, power, speed, agility, coordination, flexibility, balance, muscular endurance, cardiovascular endurance, nutrition, and caloric intake. It's very important you consider all of these factors to train an individual for a specific sports or a person who is involved in fitness or rehabilitation. Here we are going to talk about the specificity principle associated with the resistance training or the weight training. Very important to improve your performance in sports. Okay, training must be related to desired results. If you do elbow flexion, extension, knee flexion, knee extension, rotation, of course it will help. But you need to do the resistance training for a muscle group that's involved in sports. That's what we call specificity principle. Okay. What I meant was the program of weight training should be tailored to meet your needs. Performance improvement is directly related to the type of training and the training results. The body adapts and improves specifically to the stimulus placed upon it. That means you want to train a tennis player for serving, forehand, backhand, volleys, and running anaerobically. So you need to train for the skills as well as your metabolic adaptations. This is the video I showed you, video clips I showed you before, just to show you what kind of neuromechanical adaptations I have done or I am doing for what sports. You should be able to see I am working on the forehand. To improve my forehand, I am doing the resistance training there. And this one, I am doing a two-handed backhand. And also I am doing this one, I am doing the overhead or serving motion. Now, what you are trying to do is that you are doing the resistance training for that muscle groups, okay, specifically for that skill. That improves your power, your strength, hypertrophy, muscular endurance. If I do the elbow extension exercise, elbow flexion exercises, shoulder flexion, shoulder extension, knee flexion, that will help. But doing the activities, resistance activities like this, that's what I call neuromechanical training, would help your sport, improve your performance in a particular sport. I was a tennis coach for 3 years, and I used this method of training for my tennis players, males as well as females, and they had a tremendous improvement in their performance because of the neuromechanical adaptations. This type of training can be used, for example, the third one I use right here, okay, that can be used for volleyball serving, okay, and people can use that for badminton strokes, okay, volleyball spiking, they can use that. So you got to create a scenario for an individual to improve performance from neuromechanical aspect, not just the weight training on the weight machines. In the next 4 slides, I'm showing you some video clips. That's where I'm using the resistance tubing rather than weights. I think it's very important. If you don't have the weight machines available to you, you should be able to use some kind of TheraBand to train your athletes. This is a two-handed backhand. Again, I'm using the tubing. It's much easier to use. You don't have to spend too much money. This is the forehand. This is the serving and serving and overhead. This can be used for your badminton, as mentioned, to serving in volleyball. That's definitely would help those athletes to improve their performance. Another topic I am interested to talk about is women and exercise. There is an inherent difference in body composition, force, strength, and endurance. Comparing with men, women have lower whole body muscle mass, as you probably know. They have a higher percent body fat. They produce lower force production, especially in upper body, lower muscular power. Depending upon an individual, you need to really think about how we are going to train any women athletes comparing with the men. Their anaerobic and aerobic powers are much less than men. It's very important we as coaches and exercise science specialists involve the resistance training for women. Okay, women improve their strength, power, and muscular endurance just like men, but their hypertrophy of the muscle may not be as much as for men, but that will be really comparable. They will improve their performance due to resistance training. Obesity is a chronic disease in my opinion, and in the world 1 billion adults are overweight, 300 million adults are obese, and more than 35% of children in the United States are overweight. There is an increased risk for coronary heart disease and certain cancers. So how do we, since I am an exercise science specialist, not necessarily right now I do a lot of coaching and anything, I'm interested in general health of the. We are born with a certain number of fat cells in our body. That's our genetic, and it's up to us how we use them. We can provide proper nutrition, balanced diet, proper exercise, and we maintain the size of those fat cells so that we can maintain our health and avoid some kind of cardiovascular diseases. And on the right side, it's going to show you what happens when the fat cells grow bigger due to potential energy due to increased caloric intake. Lastly, I want to show you a meal plate for lunch, which I had at Ocean Pearl in Udupi. Generally, my body requires about 1,600 calories per day. But when I look into all the items I got plus rice, that definitely was about 1,200 to 1,500 kilocalories per meal. Think about this is lunch, then I have the breakfast, then I have the supper. If I add up all of those, probably I was getting about 1,000 kilocalories per day extra that will accumulate as fat in my system when I am not using. Thank you very much.
Thank you, sir. Sir, your knowledge in the field of physical training and energy system has enlightened all of us, and I am sure the valuable insights of today's lecture have given us a new perspective that sports persons should adopt in day-to-day life. Thank you, sir. Now I request all the participants to fill the feedback form. That feedback form link is placed in the chat box. Please go through the chat box and fill the feedback form and submit. May I now request Mr. Ramesh Echen to introduce our speaker of this session, Dr. Chris Kinslow, to the guests and participants of this international webinar. Word to Mr. Ramesh Echen.
Good evening, ladies and gentlemen. It is an honor and my privilege to introduce Dr. Chris Kinslow. Dr. Chris Kinslow Associate Professor, Department of Physical Therapy, University of St. Mary, Kansas, USA, PT, DC, OCS. He graduated from CC College, where he earned a doctoral degree. He has been an assistant professor at the University of St. Mary in the Stephanie Doctor of Physical Therapy program since 2014. Dr. Kinslow's clinical expertise includes manual therapy, dry needling, and skeletal manipulation. He is an orthopedic certified specialist and holds both level 192 functional dry needling certification. He brings a strong orthopedic background, having 19 years of clinical experience. Dr. Kinslow is a licensed physical therapist in Missouri. Once again, a warm welcome to you, sir. Over to you, sir.
Welcome to this presentation on ACL injuries of the knee. My name is Dr. Chris Kinslow. Just a little bit about myself before we get going. I am a physical therapist, have been since 1999. I graduated from the University of Missouri. I'm also a chiropractic physician, have been since 2005, and I'm an orthopedic certified physical therapy specialist. I also do something called dry needling, which is the application of needles in a similar manner to acupuncture, but more of a Western medicine focus. So working more on just treating specific muscular dysfunctions with that. I've spent about 21 years as a PT, and the last 14 I've owned my own practice, working in an outpatient environment, treating patients with chronic pain and musculoskeletal injuries, including ACL injuries, which I'm going to talk about today. So ACL statistics give us a background on how frequent an injury this is and how common it is. So it happens more than 200,000 times in a year. It happens a lot in our sports in which we are performing agility and twisting, pivoting, torquing maneuvers like basketball, soccer, skiing, and football. It's estimated that most of these happen when the ACL just gives out under too high of mechanical forces, i.e. you have twisted, you are torquing the knee, you are pivoting off the knee in such a way that it gives out and tears that ligament. 30% of them occur from actual direct trauma. Someone runs into your knee, someone falls on the knee, someone hits the knee. The ACL is very common in our younger age clients, 15 to 45. And while males do have a higher number of these injuries because they do participate in contact sports more commonly, females actually have a higher percentage. Thus, if you took a group of 100 females, more of that 100 females will have an ACL injury compared to 100 males. There's just more of those males that end up playing in a larger group setting. So there's something about the way females absorb force, maybe some of the structural body builds they have that make them a little more prevalent for this type of injury. So as we look at the anatomy, the first thing we need to understand is what the ACL does. and it primarily prevents the tibia, the lower shin bone, from slipping forward. And in a sense, that could also be stated that it prevents the femur from pushing backwards, the thigh bone from moving backwards, in that case like a hyperextension event. It also is involved a lot with this restraint of like a knock-kneed or valgus position, and we'll talk about how that valgus position can be combined with some rotation here in a bit and make it even more compromised. So as you see this picture of the soccer player in a position with her leg relatively underneath her hip, compared to a position where her knee is dramatically knock-kneed or bowed inwardly. And what this does is it torques the lower leg in such a way that the cruciate ligament, the anterior cruciate ligament, it becomes taut, and the collaterals are not doing the support anymore, these collaterals being the outside ligaments on the knee. So we kind of see this position that this girl is in with her trunk leaning to one side, her knee caving in. That knock-knee position is a bad point for the ACL and something that makes it at risk. So we talked about the knock-knee position and that valgus position. Now we'll talk about hyperextension as another way that this can become problematic. It's okay for us to have some degree of hyperextension, but we don't want extreme amounts above 15 degrees. That thigh bone tilts forward, and ultimately, and that's more at the hip, and so the knee is tilting backwards. And then this creates compression between the thigh bone and the shin bone. A lot of times in these ACL injuries, you'll see what's called a bone bruise of the tibia and femur, and that's because those two bones come together and really put a lot of pressure on one another and bruise that bone. And our soft tissue, including the ACL, is what limits hyperextension of the knee, and that's why it's problematic for individuals that have sustained a ACL injury. We know anatomically the knee has some receptors inside it that give us information about where we're at in space, and we know when these ACLs are injured, that can mess that type of information coming back to our brain. And this is probably an explanation for why people have had an ACL injury are much more at risk for having another one. And so both the ACL and PCL do this, and it gives our body information, our brain information, in which to help us make microscopic adjustments to that stress that's being biomechanically put on our knee. And these can affect laxity, stress, and kinematics of the joint, and affect how our body tolerates mechanical and movement type actions. As we continue to talk about the anatomy, we realize the ACL doesn't have the capacity for any elastic movement. Anything beyond about 5% of its resting length causes it to be ruptured. The contrast, the posterior cruciate ligament, which is basically the opposite direction, the opposite situation as the anterior cruciate ligament, it's much thicker and it has twice the tensile strength, so that's why you don't have as many PCL injuries. Just for reference, that posterior cruciate ligament provides 90 to 95% of the total restraint for posterior translation of the tibia on the femur. So this is the opposite. We think of ACL, the femur goes back, the tibia goes forward. PCL injuries would be just the opposite. The femur goes forward, the tibia goes back. So these are just some videos I'll let you see of the ACLs in injury. So you see the number 11 there in the blue. Her knee just caves into that very knock-knee position. Here's a position where a athlete becomes traumatically affected, where someone ran into their knee and shoved it towards the inside, again, that knock-knee position. And finally, then an athlete that hyperextends the knee. And so these are the three basic mechanisms in which this ligament can become injured. And then on the bottom part, you see really this element of torque. As the knee gets torqued inward, the knee bows in that valgus manner and really causes the knee to torque. So you look at his left knee, it torques inward and has this twisting event that occurs. And those are really the things that cause the ACL to tear. So more examples of these are kind of like more major trauma. You see the individual's knee go dramatically backward. This individual, his entire knee almost dislocated. And so as you look at, these are definitely like traumatic events and things that really are painful when they occur. So you see this individual's knee get really dislocated almost. This particular athlete hyperextends his knee and suffered a nerve injury at the same time. So the surgeons are doing the repair of these, but as physical therapists, a lot of what we're interested in doing is to look at ACL prevention programs and try to take some of the concepts of these and utilize them to say, what would we need to do to prevent these individuals from having these injuries again? The most common thing is to become aware of the risk factors that when the femur rolls in and the tibia torques out, that places stress on the knee, and it's particularly the ACL. And so if we can avoid these biomechanical or kinematic forces, or make the patient more resilient to resist against these forces, can we limit injuries to the ACL or limit re-injuries to the ACL? So again, the knee turns inward. It has that valgus knock-knee position, or the knee can become extended in these hyperextension scenarios. The shin bone twists outward, and there is a forward shear force, so that the lower leg, the shin bone, is being pulled forward. And these are the factors that really put you at risk for an ACL. There does seem to be some risk factors if you've had an ACL, anterior cruciate ligament tear, of risks that cause it to happen again. And maybe one of the things is that us as therapists aren't doing a stringent enough job of rehabbing these individuals, i.e. by putting really high standards on them. We need to do that. The other thing seems to be timing. That this is a study that was put forth that looked at athletes who returned to sports before 9 months, and that 9-month mark seemed to be very specifically correlated with re-injury. So it may just also be the fact that the activities they go back to have a very high level of performance requirements, and it's just more advanced than where they were at in their rehabilitation process. So overall, patients that were 25 years or younger that return to high-risk sports do have an increased risk of having an ACL injury, and that is, we know that. Okay, how effective are these prevention programs? It does seem to be known here that through meta-analysis and systematic reviews that we saw that strengthening balance training does reduce knee injuries in general and the ACL tears in particular. One of the simple things that we can do to help individuals is give them some very simplistic cues of land softly. So if you try that right now, if you try to jump up and then land on the ground softly versus loudly or hard, you're going to notice that your knees absorb more forces and they spread that force out over a longer period of time rather than a sudden jarring type landing. So if we tell the patients to keep their knees over their toes, this increases their knee flexion as compared to landing with your knees very straightened, and probably could contribute to a hyperextension type event. So the more flexed, the more bent we are in our knees, probably, again, the softer we're going to land. And things like this, let's simply like landing softly, landing quietly, and bending more at your hips and knees seems to be correlated with reduced injuries. Here's some videos that help illustrate, if you'd want to watch more of these ACL prevention programs. So there's been several of them over the years that have been done. And as you read or you watch these videos, you may see these individuals engaging in a lot of very controlled movements of the lower extremity that then just continue to be ratcheted up at higher levels. The basic gist is we warm them up, we move them through a bunch of activities, coaching them how to bend at their hips, bend at their knees, bend at their ankles, and absorb forces while all the while reducing or resisting the forces that would push their knee to the inside. The basic ideas of these ACL prevention programs are that the athlete would warm up with some active stretching activities, not passive stretching activities. They would engage in some agility drills, some overall practice towards their athletic event, and some strengthening exercises, and finally a cool down. So the warm-up helps to get the muscles engaged with some higher blood flow, make them more pliable and flexible. And so just simple things like forward jogging, side shuffling, backward jogging all seem to be correlated with reducing injuries if we just get these individuals loosening up before they start a very high level activity athletically. So we do some stretching exercises in which we stretch the lower leg muscles, like the calf muscles. And so this position engages your core strength in your abdomen while also stretching the lower legs. Then we stretch the thigh muscles on the front of the thigh, the quadriceps. So we just bring the heel up towards your bottom, and we want to work on controlling our trunk so we're nice and upright and not leaning to the side. We stretch the back of the thighs, the hamstrings, and we want to have the person reach down towards their toes, but not so aggressively that they're over torquing. And then an inner thigh stretch, just doing the same thing with the legs spread apart to get the inner parts of the thigh muscles to stretch out as well. The front of the hips need to be loosened up, and we do this in a hip flexor stretch that is kind of done in a kneeling or lunging position, and then just bringing the leg back, and our trunk leans forward slightly so we feel this in the front of our thigh, the front of our hip. And then we do some agility balance exercises in which the patient would stand on one leg and reach down to the floor while trying to keep their balance, while trying not to allow the trunk to be moving vastly side to side, while trying to maintain control of the trunk and not allow their body to get out of a midline position. And then we do some sports-specific type activities. In this case, the gal's doing some soccer-related activities in which she's practicing balancing while kicking and just working on making her body more stable, more resilient to some of these forces while in a single leg stance position. So then we start working on squatting and jumping, and the idea is to avoid the positions in which the knee would be compromised. We saw in some of those earlier slides that knock-kneed or inward bowing of the knees. That's bad, so we teach the patients to push their knees apart and land in a wide position with the hips, knees, and ankles all bending. To help reinforce the proper activities of jumping and movements in the leg, we do what's called a tuck jump type of maneuver, and we have the patient bend their knees and hips to jump upward, bend the knees and hips while up in the air, and then land with a very absorbing and softened position where the knees, ankles, and hips all bend as well. So this is the tuck jump. This slide shows a lot of the errors we see in landing with the tuck jump, i.e. the knees torque in and have that knock-kneed position, or the knees don't bend enough and they're stiffened, and so they're maintained in a more straightened position. In letter C, you see the person landing on one leg more than the other, so they have a leg dominance, and that puts that leg at a lot higher forces, and if anything goes wrong there, that could be problematic. D shows an example of what could go wrong, which would be they land on one leg and the trunk radically deviates off to one side, and that causes a lot higher forces to be placed on the ACL. Lateral jumping goes out of the sagittal or front to back plane and working more on a side to side plane. And again, the same thing, we want to keep the knee out of that knock-knee position, so as they jump side to side, they land softly, they bend at the hip, the knee, the ankle, and they don't let the knee cave inward. Finally, we see strengthening gains that are used to work on the core as well as the lower extremities themselves seem to make the person more resilient and less likely to have problems with an ACL tear. So we see front planks and side planks given to strengthen the postural core muscles, and this seems to help allow the patient to be more resilient to some of the forces on their body, and thus their knee doesn't get torqued and bent in ways that cause problems. These Russian hamstring curls or Nordic hamstring curls are what they're sometimes called, in which a patient lowers down very slowly. So this is a negative type lift or an eccentric activity in which they slowly allow the knees to straighten and the hamstrings have to resist that. This really is something that helps the ACL because the ACL is protected with knees that are flexed more, and so making the hamstrings very strong helps us to flex the knees more and not let them hyperextend. Single leg calf raises really strengthen the lower part of the leg, so we stretched this to start with, and now we're strengthening it by putting all the force on one leg. We make the calf muscles very adept at controlling and acting almost like a shock absorber to our leg. The lunges, we look again for this ability to lower ourselves down slowly in this split type stance. We want the knees to avoid torquing inward. We don't want the foot to torque outward. So these are things where we want this symmetry of the body. We want everything to be in a line. These particular videos show some single leg and double leg hop tests that have quite a few errors in this. So as you look at this, you'll see this young lady land and her trunk becomes very deviated, her knee deviates off to the sides and caves inwardly. So her trunk shifts and her knee is really all over the place, and this particular female had an ACL tear in her past history.
Yep.
Now she's doing a double leg landing, and you can see the knees again cave off cave inwardly, as well as they bow inward when she goes to jump. So they almost come knocking together, and that's how she's generating force, and she's certainly not resisting those overall movements. In conclusion, we know that ACL injuries happen to a lot of athletes. We know the repairs have come a long ways, but the rehab process still is not preventing some of these individuals from re-tearing again. What we think is that shorter rehabs are not always better, that sometimes there is a time component to get that ligament repair to strengthen. We also know that these faults of letting the knees cave inward, that knock knee position, that torquing inward position, or hyperextension definitely are problems when it comes to the ligament health. And so trying to train individuals to resist those forces would be logical. And the stronger your core, your hip is, the better. The stronger you are at landing, the better you are absorbing forces, the better you are at controlling your knee movements. The stronger your muscles of the entire lower leg are, the better you're going to be and the less likely you are to have an ACL injury reoccurrence. And one of the things that we're trying to do with our students is remind them that just because you sent your patient back to sport doesn't mean that they're actually ready for that sport unless they've passed a bunch of functional tests that would mimic the activities of their sport. So we think about soccer, we think about football, we think about basketball, we think of a lot of different sports in which there is the need to twist, torque, cut, pivot, and do a lot of dynamic athletic events. We probably need to mimic those long before the person actually puts themselves in an athletic arena, because at that point they do tend to function at a lot higher level than what we would see in a clinical setting, i.e. they're going harder, they're more motivated, they're more engaged with the activity, and so we have to have them prepare for that before they're exposed to it for the first time. So I want to thank you for listening to this lecture. I hope you got a little bit about the knee out of this, and I hope you learned something, and look forward to hearing any discussion in future points. So I'll leave my contact information with Dr. Shetty, and if any of you want to reach out and ask questions, I'd be more than happy to answer those. Thanks again.
Sir, thank you very much for enlightening us about ACL injury, its rehabilitation, and training in sports. I hope most of our sports persons would have benefited from your today's lecture, sir. Thank you very much. Thank you once again. Now I request Mr. Haridas Kulu, Assistant Director of Physical Education, Joint Organizing Secretary, to propose vote of thanks. Over to Dr. Haridas Kulu.
Good evening, ladies and gentlemen. We are happy to say that the international webinar on physical training and rehabilitation has concluded with grand success. It is my pleasant duty to thank all those who have supported us to conduct this webinar successfully. First of all, I thank the chief patron of this webinar, Honorable Vice Chancellor of Mangalore University, Professor P. Subramanya Yadapaditaya, for his valuable guidance and all-hearted support to organize this webinar successfully. Our special thanks to today's resource persons, Dr. Anand Shetty and Dr. Chris Kinslow, for educating us with the new knowledge on energy systems consideration for physical training and anterior cruciate ligament injury. It is ACL injury and its rehabilitation. On behalf of Mangalore University and Department of Physical Education, I extend heartfelt thanks to you, sir. We extend our heartfelt thanks to Mr. Raju Mogavira, KAS, Registrar of Mangalore University, syndicate members of Mangalore University, Registrar Evaluation, Professor P.L. Dharma, and Finance Officer Professor Narayan for their valuable support and guidance. Heartfelt thanks to Commissioner of Kendriya Vidyalaya Sangathan, Ms. Rupati, Physical Education Director, Besant Women's College, Mangalore, Mr. Ratish, Mr. Binu, Mr. Surya, and Mr. Kusha, sports officers of Kendriya Vidyalaya Sangathan, for their wholehearted support for the success of this webinar. I extend sincere thanks to my colleagues in the department, Mr. Shaban, technical person, Mr. Ramesh Ecchen, Joint Organizing Secretary of this webinar, for their wholehearted support for the success of this program. Dr. Kishore Kumar CK, Director of Physical Education and Organizing Secretary of this webinar. Under his direction, the international webinar has been organized with grand success. Thank you, sir. Definitely, we remember the work done by the different persons in a large way, being responsible for the success of this webinar. I extend heartfelt thanks to all of them. I extend my special thanks to all the participants of this webinar and who have supported directly and indirectly to conduct this webinar with grand success. Thank you, one and all. Over to Kishore, sir.
Well, thank you, Mr. Ramesh Echan and Dr. Haridas Kulu. Once again, I take this opportunity to thank each and everyone for their kind help in the success of successful organization of this international webinar. Friends, on the 18th November 2020, we have decided to conduct national webinar on National Education Policy 2020. Its status in physical, status of physical education and sports in National Education Policy 2020. I request all of you to register for the said webinar and make use of it. And you can give your suggestions, your valuable suggestions can be mentioned in the Google form while registering your name for the said conference webinar. So once again, I thank each and everyone for your great support for success of this program. Thank you all, and good night.